Dr. Knowles, we're going to talk about youth sports physicals. What are they?
So sports physicals are evaluations that you do with your physician prior to participating in the local school sports. The school districts require that children be cleared for sporting activities at the beginning of the year.
Okay, and then will they be approached differently when it comes to a boy versus a girl in a sports physical?
They're quite similar. We're just assessing that the child doesn't have any significant risk factors that would preclude them from participating in sports. The vast majority of kids are healthy and will tolerate participation in sports without difficulty. So they're a pretty routine checkup for sports specifically that we do, but no significant differences between the physical exams and evaluations that we do for either boys or girls.
And what is the importance, though, of having a sports physical done, especially on a youth athlete?
So it's important for us to make sure that they're physically healthy enough to participate. And as I said, the vast majority are, but there are occasional findings of people reporting certain symptoms that would prompt further evaluation before they would be cleared to participate in physical activities.
Okay, and is there anything that parents can do to help their child prepare for a sports physical?
Helping them just understand that it's a pretty routine, pretty minimally invasive evaluation. We just go over any symptoms they might be having, making sure that there's no history of like exercise intolerance or shortness of breath, and checking in on their family history as well, but just explaining to them that it's actually even easier than their regular routine checkup.
And Dr. Knowles, what happens though if something is identified in the physical?
So if we identify something that is concerning, we typically will not clear them to participate in their sporting activities until they've been thoroughly evaluated. So occasionally we'll have some history of dizziness or passing out with physical activity or chest pain or shortness of breath. And that often makes us concerned about possible cardiac issues that you'd want to be very thorough about making sure there's no underlying health conditions that might be exacerbated with participation in sports.
And do you think it's a good idea, though, for young athletes to have reoccurring sports physicals?
It is a good idea. It's also really good for children to get in and see their physicians, particularly middle school and high school students, as that group of kids we often don't see very frequently. And we do recommend seeing your physician once a year, regardless of your age.
Great advice right there, especially for all those parents to note. Make sure it gets on the calendar. And Dr. Knowles, where can we go to learn more?
Healthychildren.org is a great website, and then also Saltzer Health is a good website for information.
Great. Dr. Knowles, thank you for your time. Really appreciate it.